Hello, my name is Nina Kazoizode and welcome to our special webinar celebrating the International Day of the Midwife 2025. This year, the International Confederation of Midwives marks its 34th year of championing the extraordinary role midwives play globally. For decades, International Day of the Midwife has put a spotlight on the vital contributions of midwives in maternal safety, health equity, and their essential role in crisis response. The term midwife literally means with woman. This simple yet powerful definition beautifully captures the essence of midwifery. Midwives are there at every step of the way, offering support and guidance to the woman, the birthing people, and the families during one of the most transformative life experiences of their lives. In the UK, midwives are at the heart of delivering high quality, inclusive and compassionate midwifery care, especially in a time where the challenges of increasing complexity in reproductive health are felt more than ever. As we face growing multiple health problems and conditions, compounded inequalities and diverse populations, particularly in London, the area I work and serve, the most diverse region in the UK, our midwifery workforce is under tremendous pressure. This year's theme, Midwives Critical in Every Crisis, couldn't be more relevant. The ICM reminds us that in times of crisis, midwives are critical. Whether in response to health emergencies, societal challenges, or the evolving needs of our diverse communities, midwives are truly at the forefront. Their work not only supports women, birthing people, and their families, but also strengthening the fabric of healthcare systems worldwide. So to celebrate International Day of the Midwife, we brought together a diverse group of experts and service users to share their insight, expertise, and experiences. Today's discussion would explore midwifery as a compassionate profession and the profound impact it has on maternal and community health. So without further ado, let's dive into today's inspiring conversations. So I'm delighted, and it is a pleasure to introduce Professor Michael West, CBE Senior Visiting Fellow at King's Fund, Professor of Organisational Psychology at Lancaster University, Emeritus Professor, Aston University. Professor Michael West does not need an introduction, but I am just going to give you a brief summary of some of the important work he has done relevant to today, and his biography, and in fact, the biography of all of our speakers will be available for you to look at later on. So Professor Michael West is a leading expert on compassionate leadership in healthcare, as a senior fellow visiting the King's Fund and a member of the Advisory Council of the Global Compassion Coalition. With decades of research and over 200 publications, Michael's work has transformed how we understand the link between compassionate leadership, staff well-being, and safe and high-quality care. He led national reviews into mental health of doctors, nurses, and midwives. His work on the courage of compassion highlights the essential role midwives play in delivering care with humanity. His latest book, Compassionate Leadership, is a powerful guide for anyone working in health, especially relevant today as we celebrate the leadership and care midwives provide worldwide. And admittedly, one of my favourite books, and for an extra treat, you can even hear him narrate the audiobook himself if you wish to purchase it. So, Michael, over to you, and it's great to have you with us.
Well, thank you, Nina, for the very generous introduction, and thanks for inviting me to be part of this webinar for the International Day of the Midwife. As you said, it's a transformative experience, the moment of birth, and for me, as a man, the peak experiences of my life were being present at the birth of my children. And I think the question of how we can create the conditions within midwifery where midwives are able to deliver high quality, continually improving and compassionate care is a hugely important issue in relation to this transformative experience for women, birthing people, families, and also how we ensure that we create the conditions where we're providing high quality, continually improving and compassionate support for midwives themselves. And what our research evidence tells us is that the key elements of cultures of high quality, continually improving and compassionate care are having really clear and ever-present visions and values about the work that we're doing. We don't lose sight of how transformative this experience is. Just what an extraordinary job midwives do in enabling the birth of new beings emerging from the great mystery of our existence. It's about ensuring also that we're creating cultures of support and compassion, cultures where there's a commitment to learning and innovation, continually improving the quality of care that we're providing, cultures of equity and inclusion where everybody feels valued and respected and supported, and where we're really developing really effective team working, which is at the heart of delivering high quality, continually improving and compassionate midwifery. But at the heart of all of this has to be compassion. It's the core value of everyone working in healthcare, and particularly it's the core value in midwifery. What does it mean? It's in practice, it's 4 behaviors. It's being present with the other person who we're helping. It's listening to them with fascination. It's really seeking to understand what matters to them. It's empathizing with them, and it's wanting to help by providing high quality care. And we know that, if you ask women and families what they want from those who provide their care, they want midwives who will be present, who will be listening with fascination, as it were, to them, who will seek to understand what matters to them, what's happening for them, their challenges, their difficulties, who empathize with them, who show that they care and who want to provide high quality care. And, we know from all of the research over the last 20, 30 years that when we look at the data that predict high quality care in healthcare, the number one factor that emerges is levels of what's called staff engagement, and particularly the extent to which staff are involved in decision making. So the more that there is collective leadership and involvement of people in the way that decisions are made about midwifery care, the better are the outcomes in terms of care quality, the satisfaction of service users, error rates are much lower, even financial performance. And the key factor that determines staff engagement or involvement in decision making is whether they have compassionate, supportive leaders who are present with them and listen to their concerns, who understand the challenges they face, who empathize with them, and who are focused on helping them to do their jobs more effectively by helping to ensure they've got the resources they need to do their jobs effectively, the right numbers of staff, the right equipment that works, the right training, and that they're helping to remove the obstacles that get in the way of the delivery of high quality, compassionate care. What we also see is that in cultures of equity and inclusion in healthcare, where everybody feels valued and respected and supported, regardless of their professional background or their demographic background, that translates through into the quality of care that's provided. So what we see is that service users are treated with much greater compassion and civility when there are cultures of quality, of equality and inclusion and valuing diversity in healthcare. And team working, the quality of team working, proves to be immensely important to the quality of care that's delivered for service users. And in general, I think there is huge scope for improvement in how we work in multidisciplinary, multi-professional teams, where we value each other's contribution, where we've got clear goals, and where we work in compassionate ways, providing care and support to each other in service of providing high quality, compassionate care for service users. And we know that the better the quality of team working in maternity services, the far better our care outcomes, and far better is the satisfaction of service users. And burnout and work overload are key factors that get in the way of the delivery of high quality, compassionate care. And we're seeing rising levels of stress and burnout amongst midwives across Europe and worldwide. And we must focus on addressing the issue of work overload, which is the number one factor in staff stress. Our job must be to support, develop, and care for midwives in order that they can support and care for those they provide services for. So compassionate leadership, collective leadership through effective teamwork, inclusive leadership through creating cultures that value and respect and support everybody are key to our ability to deliver high quality and compassionate care in maternity services. So I would like to say a thank you to all of the midwives around the world who engage in this hugely important part of what it is to be humanity. Thank you for all of the work that you do.
Thank you, Michael. Really a great way to set the kind of the tone of where we go. As you were talking, it really, what stood out for me, I have heard you speak many times and I have read your books, but really, for me, it comes down to that compassionate is about that human connections that midwives make, and the four very simple pillars around your compassionate leadership framework is really easy to be present and listen. And I love the fact that, you know, the terminology that you use often around listening with fascination and seeking to understand, which is particularly pertinent around this time where there are some external scrutinies in England, as you know, around some of the challenges and perhaps where we don't get it right all the time because of the system that's not really enabling the midwives to provide the care they wish, which really does bring us into your talk about the burnout. And more recently, I come across the term being perhaps the coin a phrase of being presentism, where you are there because you don't want to leave your colleagues left short, but actually you don't have what you want to give and be able to provide that care that you want, that moral injury that we are mindful and aware of. So that's really helpful. But the really important point that you brought up about the staff engagement, which brings us and is a wonderful segue, if I may, to our next speaker, who Jill Walton, who really part of her role is to, as part of a collective leadership, to bring the voices of midwives. So if I may just do a brief introduction. Welcome, Jill. It's a pleasure to have you as part of this discussion. So Jill Walton, for those of you who haven't met her before, is a CBE General Secretary and Chief Midwife of the Royal College of Midwives. Jill is a respected and a passionate leader who has spent her career championing midwives and the vital role they play in safe and compassionate care. At the RCM, she advocates fiercely for members, ensuring their voices shape national policy and workplace cultures, as we just heard how important that is, and is also a powerful advocate for collaborative, multidisciplinary working and co-leading the One Voice initiative with the Royal College of Obstetricians and Gynecologists to strengthen safety and respect in maternity services. And with a background as a Director of Midwifery across several major NHS trusts and deep involvement in National Transformation Programme, Jill continues to lead with heart and purpose, an inspiring example of a compassionate leadership in action. So, Jill, over to you.
Thank you so much, Nina, for that introduction, and thank you, Michael, as well, for your inspirational talk. I'm here today really to celebrate midwives. International Day of the Midwife means a lot for us in terms of the importance of what midwives do every single day, sometimes in the face of adversity. That's in our own country, but definitely globally. And we hear those stories that are so heartbreaking about how difficult it is sometimes to provide safe maternity care to women and families. But I'm going to start by saying that actually all leaders, all midwives are leaders, and they demonstrate the most amazing leadership skills every single day in the care of women. Midwives are autonomous practitioners, as you all know, but their key role is to be with women and to advocate for them when they can't advocate for themselves. When I look at the role of the midwife and what midwives do every day, it is quite simple. They listen to women. They help women understand the choices that they have during their pregnancy, during birth, and afterwards, the choices that they may have to make around their health and the health of their family. And the most important thing they do is they really help women understand the risks and benefits of some of those choices. Now, women come with their own life experiences, their own thoughts and feelings about what they want during their pregnancy, birth, and afterwards. They also have different understanding of childbirth and what actually can happen to them. So the role of the midwife is so key, to have time to really get to know women and really think about how they can advocate for them throughout their maternity experience. That only happens when women trust midwives. So it starts with the midwife and the person, and really the values that they hold, the reason that they went into midwifery in the first place. And I think we've already heard it this morning, it's how do midwives hold that value of compassionate care, that skill they have to really listen to women, make them comfortable at their ease, so that women have a good experience of maternity care and feel empowered during that process. We know that maternity services, particularly in England and in other countries around the world, have had some difficulties. Some of that is because the system doesn't recognise the value of good maternity care. And that's why we need midwives who develop leadership skills over time so that they can raise the profile of this essential service to the future life and the future population. Because it has been advocates for women collectively that could only make sure that everybody understands the importance of safe, good, respectful, compassionate maternity services. So I know that there's midwifery leaders out there everywhere, constantly trying to advocate for women and better care and safer services for women. It is difficult, and sitting in my role, I know it's difficult. I feel sometimes like I am not heard. And I've done everything from banging my fist on the table to being really overly passionate, to being quiet and try to be influential, to show the positives and the importance of having high profile maternity services. But yet we are still unseen in the system. So we still have to invest in leaders with skills that can continue to influence every table in the system, where we know that we need a louder and seen voice. And it's a seen voice. It's not just hearing, it's seeing what's going on and doing something about it. Leadership just doesn't happen at that level of leadership, whether it's within a team, within a system, within a national platform, doesn't happen overnight. And so we absolutely know that investing in leadership development is key. And again, that's something that's been really difficult to provide in the NHS. And we know that that is probably the key to improving maternity safety, but also that culture change that is really needed. And Nina, you said at the beginning about the role that we've played in the college to try and bring the collective of the professional associations together and women's voices. And we call it One Voice. So it's organisations representing parents and babies, and it's all the professions around maternity and neonatal services. So we can all have a clear and one voice about the importance of good maternity and neonatal care and the safety of the services, so a collective leadership. And going forward, that has to be the most important thing. And so when I look at my midwifery colleagues who work in services, sometimes in the face of adversity, the one thing you can do as a leader is bring everybody around you who are looking after women and families and babies and have a clear focus about what you can do together. That is the most important leadership thing that you can do. And that does help create the culture change I think we're all looking for. The RCM, and I will end my talk by talking about the RCM, because I believe as an organisation we have a major leadership role in supporting our members and creating that collective leadership. The RCM is here for its members, and it is here to support members in the everyday working life. And that includes how they are led and managed and how they are allowed to lead and be advocates for women. So it's really important that we have that connection with our members and support them in doing that. Every single member has an opportunity to belong equally within the RCM to be able to deliver great care to women. We know the next most important thing is to help those members have a voice in their local service, within their local system. And so it is up to us to work with them, to empower them to have a voice, to make sure they have the skills, the support, and be valued to do the great thing that they do every day in caring for women. But we also amplify their voices, so on their behalf. That's why all the system, government, the top of the office in the NHS, you will see the RCM has a seat at the table. That hasn't always been the case. For a long time, we were lost within other professions, whether that's obstetrics or nursing or just in health generally. But I absolutely believe that midwives have to have a single voice as midwives to represent the women that they care for. And that is absolutely important that we do that. So they are recognised for that contribution to the future health of the population. Finally, I would say that, collectively as leaders, we are this midwifery community that has this collective voice. And that collective voice that thinks and reflects and trusts each other can absolutely make a difference to the future of maternity care in the UK, but hopefully across the world. Thank you, Nina.
Thank you. No, that's really important. And I think there were 2 points that you made, which I think are worth emphasising. And one is that leadership is not attributed to a title. Every single midwife, no matter where they are, where they operate, and where in the system they sit, they are a leader in their own right, and they do have a voice, and they are able to influence. And it's important for us to recognise and actually celebrate the fact that we have got the association, a member association that only is able to acknowledge and be the backbone, actually the voice of midwives. The Royal College of Midwives only does talk about midwives and recognises the role that midwives have in coordinating the care whilst being the autonomous practitioners and also the experts in physiological birth, but knowing when things deviate and be able to bring the other experts within the multidisciplinary team is absolutely important. So it's really great to hear that the work that's going on with the Von Voice group to collectively look at how do you bring expertise to provide the care that we all want to see, because I'm yet to see a midwife, and I'm sure you feel the same, Jill, that leaves the house in the morning and thinking, I'm not going to do a good job today. So it's about how do we create a system and that culture in which they can operate and provide that compassionate care. So thank you. But as you both have said so far, really at the heart of the centre of this are the women, the birthing people and the babies, the future generations that we're all here to support and optimise the health and well-being. So it's really timely to bring in Omar Campbell. Omar is a London service user voice representative. She works at King's College University Hospital, the Denmark Health site, as a maternity and neonatal voices partnership, which really means that she champions the voices of women, birthing people, and their families to shape and improve the services they receive. Now, I am very lucky because she serves as a London service user voice representative to make sure that we really do bring the diverse voices of all of our service users across London in shaping our services as we try to support our populations in London. And what I just, in terms of, obviously, Omar is multi-talented, and amongst other things, she has a background in education, advocacy, and patient experience, and she's driven by her own journey throughout maternity services. So you won't be surprised to hear that her work is rooted in compassion, inclusion, and the belief that respectful care and responsive maternity care is a standard that she believes in, but it shouldn't be an exception. So, Omar, thank you for being here, and be happy to share your experiences. Over to you.
Thank you, Nina. I'm very privileged to be here. Typically, as an MNVP lead, I don't share my birth story, but obviously it's really important today to talk about the role that midwives have in your birth and why compassionate care is really important. So I think my birth story really resonates with this year's theme of midwives being critical in every crisis. And that resonates with me just because of my own birth story and what happened during the first birth of my daughter. So my daughter was born on her birthday, which was her due date, I should say. But my midwife, who was looking after me for most of my care, was actually working on her birthday. So she was convinced that I would go into labor on her birthday. And I remember thinking to myself, wow, isn't she incredible? She's here working on a Friday night and it's actually her own birthday. It wasn't to be that my daughter was born on my midwife's birthday. My midwife was Felicia, and she was born a few hours afterwards, and so her birthday fell on the next day. But my labor was extremely intense. I was constantly being sick. I was projectile vomiting. I was completely drained, and I was really overwhelmed. But throughout it all, Felicia was just always there. She never complained. She never once thought to herself, this is a bit much. She's constantly being sick. And I remember in that moment thinking, how does she do this? I couldn't imagine having to clean up someone's constant vomit. And she was just so calm, so patient, and just kept reassuring me that everything would be fine. I felt as if Felicia was going above and beyond what she should be doing, and that was partly due to the fact that Felicia was a bank staff member, and so she wasn't even actually a permanent member of staff. And I know from my experience as a teacher, typically there's an association with people who are not permanent members of staff, that they don't have that same level of commitment, and you might not get the same service or outcome that you might expect. But that was not the case with Felicia. She was completely professional, and she showed me that she cared about everything that was happening during my labor, and she wasn't just going to clock out. About 20 minutes after my daughter was born, her father noticed that she didn't look quite right. She looked quite pale. She was struggling to breathe. I didn't notice. I was so tired. Felicia was quite confident that she was fine, but she listened, not just because it was me who was saying it. She listened to her dad, and she wanted to reassure him as well. And I think that shows that in that moment, she showed that listening is really important to the person giving birth, but also those partners who are in the room who are also mindful of what's happening around them. And it was at that point she went to reassure him that we realized that my daughter had had a cardiac arrest, and we don't even know how long she wasn't breathing. Obviously, I was extremely distraught. I was panicking while everything was happening. And I think that's where the theme comes in, that in that moment of crisis, she was critical. She was critical to reassure me. She was critical in calling who she needed to call as quickly as possible. And in that chaos, she showed the collaboration between herself and the other members of staff, and how teamwork is really important. Felicia showed continuity in her compassion. She went above and beyond what I think she would have done, or what I would have thought someone would do when their shift ends. I unfortunately ended up in A&E, while my daughter ended up in the neonatal unit. But she didn't just clock out. She came to visit me in the A&E and see how I was. And on her next shift, the next day, she even went to visit my daughter in the neonatal. And I think that really resonated with me, because she was so compassionate that she thought about me even once her shift had ended, and she came to ensure that that level of care and compassion continued even while she wasn't necessarily going to be on shift at that hospital again. And I remember thinking, this is something that I would have never have thought would happen, in the sense that she wasn't a permanent member of staff. We already had that special bond anyway, because it was her birthday a few hours before my daughter was born, and we've always kept in touch. Every year we share this bond where I wish her happy birthday, she wishes my daughter happy birthday, and although we've never seen each other again, I always remind my daughter of Felicia and the role she played in what I think means that my daughter is here today, because of her listening and her compassion. That experience has taught me the role of midwives in your care and why they're so important. And it's something that I hear all the time when I gather feedback from service users. They will always remember the midwife who was outstanding and exceptional. They will always remember that midwife who went that one step further in their care. And Felicia had such an impact on me that I remember asking my mother, do you even remember the name of the person who was your midwife when she had me? Because I just wanted to see that connection and understand, if you've had a positive birth experience or it hasn't gone to plan, does my mum even remember who she was? Unfortunately, she doesn't, but it was so profound for me, the role of Felicia, that I felt it was something I needed to know about my own birth story. So we're here today to celebrate midwives, and it's a thank you. It's a recognition that midwives are the backbone of safe, respectful, and empowering maternity care. They are critical in every crisis, and we need to acknowledge the role that they play, even when they're not a permanent member of staff. Even if they are having a difficult day, we need to remember the compassion that they give to all the women and birthing people that they help support on the hospital ward, in the community, in that antenatal clinic. Felicia reminds us that kindness is possible, and when it meets skill, it can change your whole birth experience, even if it had gone off path and it never wasn't the birth that you expected it would be. So my closing words are to thank all the midwives across London and the UK and across the world, because you're critical, you're courageous, and you are change makers. And every time you advocate for a woman's choice, or you make the effort to check in on a baby you've helped, you're shaping someone's lives. And I know you shaped mine, and you've shaped my daughter's. So I am forever grateful to all the midwives who care for service users, and always a special thank you to Felicia, and I always wish her a happy International Day of the Midwife. So thank you.
Thank you, Omar. I have to admit, I did not know your story and I was taken aback, and I hope you're okay and sharing it. It must be difficult reliving that experience. So I am grateful for your candidness and your openness to wanting to share this. So thank you. And I hope it's okay for you to have to go back into that part, which it's only hearing it sounds very traumatic. But thank you so much for sharing this. And it really does resonate with what we have said around the listening, but not just listening, acting on what you hear and providing that assurance, using your skills and the evidence base that really underpins it to support the family during this really tremendous difficult time. Because I think as midwives, we witness on a daily basis deep vulnerability, fear, love, and that support and that professionalism really is incredibly important. So thank you for your honesty and openness, Omar. It's really appreciated, but it was really heartfelt. So on behalf of all the midwives, it's and what you do at the moment in London and in a wider context is it's absolutely fabulous. So thank you. And as you know, London has a diverse population, so we wanted to give you a flavour of our diversity and the fact that we celebrate that diversity in London, and that's something that we pride ourselves in. So last but not least, I wanted to bring Sian Welby, who is a mother, but as a professional, she's a TV and radio presenter, and she's a Capital Breakfast radio presenter. So thank you for being here, Sian, and over to you.
Oh, thank you so much. And it's been really lovely hearing everyone's stories today and hearing from different experts as well. I'm obviously no expert and I can only speak about my experience, but working in mainstream media, whether that's in radio or on television, I do feel a responsibility sometimes to represent certain experiences, good or bad. And at the time when I was going into labour, there was a lot of negative press around midwives, and there was a lot of stories. And as always, it's the negative ones that make the headlines. And it's very easy, and you realise this when you work in media, that once one negative story starts, there's a bit of a snowball effect, and before you know it, it just felt like a very unfair representation of midwives for some reason, rather than the system or the government getting some sort of blame. It seemed to fall on individuals, and so I felt very passionate to share my positive story, because I went to a normal NHS hospital. I wasn't treated any differently. I planned to have a water birth. It didn't go to plan. I ended up having an emergency C-section. So, there was a lot of drama and things, being nervous. And I met a lot of different people. The midwives that had been with me through my pregnancy actually weren't working on the day I gave birth. So there was lots of different reasons why I could have felt really anxious, and things could have could have spiraled out of control. I suppose you never know what's going to happen when you have an unplanned operation. And my experience was that every single member of staff that I met were incredible. Whether it was the surgeon, whether it was a nurse, whether it was a midwife, whether it was the cook who was bringing you toast, the next morning, there was such a warmth and there was such a passion from everybody I met. And I felt really safe and really reassured. And I'm not someone that really flaps or gets nervous in general. And I found myself, feeling nervous when I was suddenly, getting an injection in my spine and about to go under major. And everyone in that room just made me feel calm. And every time I panicked, they had words of reassurance. And I just remember thinking, what incredible people you all are. You don't go into being a nurse, a doctor, and, I know that everyone that does those jobs goes into that because they are caring people. And I described the midwives that I encountered as guardian angels, and I think you all are. I think you're in a job just yourselves, and I saw how relentless the job was, how long the hours were, how desperately hard it was to keep a smile on your face and be that brave face when there's a load of women, million questions, and you've got that little buzzer because you don't know what's going on and you're hoping that someone's going to come and answer. And I was on a ward of 6 other mums. And like I say, it wasn't maybe you got celebrity treatment. Well, I didn't. I was treated exactly like everybody else, and probably most people wouldn't have known who I was. But I also witnessed how everyone was to the other women who were giving birth and had given birth, and the younger midwife, she came in. It was the day after I'd given birth, and she looked teary-eyed. So I said, "Oh, are you all right?" And she sort of smiled and she said, "Oh, she took a big breath, and I felt, I really felt her emotion. And she said, "I've just had a bit of a mad morning." She said, "We're 2 staff down because of illness." She said, she'd helped deliver 2 sets of twins, and I think there'd been 6 other births that morning. She wasn't giving everyone enough of her attention. "I just don't feel like I've seen any of you enough." And I just said to her, I was like, "Oh my God," I said, "that's not how I feel." I said, "I have no idea that you've had such a mad morning." I was like, "The way you've greeted me and the smile and you've asked if I'm okay." And I said, "I feel like I'm getting one-on-one treatment." And yeah, I knew I wasn't. I was in a ward of 6 others, and I knew she'd had a busy morning. But it was the warmth and that dedication and the fact that she was her toughest critic. We don't need the press to have a go at anyone. I know in that job, you must be the toughest critic on yourself. You're dealing with so many unplanned scenarios and situations that you just cannot know what's going to happen. And you have to go in every day not knowing what your day's going to look like, some of the parents. And I salute you for that. And I also think, and others have said it, know that. Of course you don't. Of this individual, because you're all doing an instances. I don't know enough about the under-supported and at times obviously understaffed, and maybe you don't have the resources. And also, as someone who's become a new parent, I feel like from giving birth to just being it shouldn't be. But I feel like parents are struggling more than ever. I think we're all stressed, we're all overwhelmed, whether you're the parent, whether you're the midwife. There's so much pressure on all of us to be doing an amazing, incredible job, but also 20 other things at the same time. And I respect that it is, and how the world isn't set up really for modern situations. Me as the mum, I've had to go back to work a lot earlier than a lot of people do, and a lot of mums do have to, and a lot of parents both have to go back to work, and it's not 2 working mums and dads, and that is just the way it is, or 2 dads, 2 mums, whichever the scenario is. I think I do hope that midwives and just labour wards in general, I would love to see you get more support, more funding, or whatever it is that you need. And I hope you are amazing and you are doing an incredible job, and it's just the system that at times is perhaps letting you down.
Wonderful. When you were describing the kind of your experience, I mean, you have this wonderful way of helping anybody who's listening to you to visualize the chaos that takes place around the labour ward, postnatal ward, and actually having that midwife who knows what's going on and being able to assure you and give you, through that human connection and the relationship that you build, take you through it. And I think it's really important, one point that you brought up, that actually for a lot of expectant parents, this is the first time they have to set foot in a hospital setting or in midwifery-led care unit. And that in itself can be quite daunting experience. So thank you for bringing that up. It's been a fascinating day. I could just listen to all of you for hours. But I love the point, and I'm going to keep that, your coin a phrase about guardian angels, and I will tell that to our midwives in London, and I'm sure Jill will take that with her back to all the midwives and the members of the Royal College of Midwives. It's a pleasure to introduce Kate Brintworth, the Chief Midwifery Officer for England, with almost 30 years of leadership experience in midwifery and maternity care. Kate has played a key role in national initiatives like Better Births and the development of local maternity and neonatal systems, ensuring compassionate and high-quality care for all. She founded the Capital Midwife Ethnic Minority Fellowship, supporting career progression for midwives from diverse backgrounds, an initiative that won a Royal College of Midwife Equality Awards in 2023. With a strong clinical background and a commitment to tackling inequalities, Kate continues to be the voice of midwifery nationally, and her work emphasizes the importance of compassionate and inclusive leadership and empowering midwives to make a real difference in the care of women, birthing people, babies, and their families. And Kate was the first Chief Midwife for London, so it's a really great pleasure to welcome her back to a London conversation. Welcome, Kate, and thank you for being here.
Thank you, Nina, and hello everyone. It's lovely to be back in London. As you say, it was such a privilege to be the Regional Chief Midwife for London. The first thing I have to say is Happy International Day of the Midwife to everyone. I think it's so important that we celebrate midwives and midwifery. Not just because every trust I go into, I meet really dedicated, hardworking, thoughtful, kind, compassionate midwives who are really restless to improve the care that they give. It's really interesting when you go and people talk about all the initiatives that they're doing and say, but we've also got this really long list of things we want to do as well. It's so lovely to see that real desire to make sure that every woman and every family that they welcome into their service has a midwife with them providing the best possible care. One of the things that I know midwives worry about is there enough of them to do that job and to do it well? And one of the great things to say is that at the moment we have more midwives than we have ever had before, at over 23,600 midwives. And I think the number might be even more than that now. And I think it's important to stop for a minute and say, well, how is that the case? And I think the first thing to say is thank you to all the services and universities and colleagues. You have done this. It's you who has created the conditions to educate and train the midwives of the future. You've created all those learning opportunities to undertake that support, that reflection, that teaching, that education. And that is what has made the difference and enabled us to recruit more midwives than ever before through training fantastic students. But one of the things that we learned during COVID is it really highlighted that we need to look after each other. And I know that's something that Michael West talks a lot about. The care and compassion that we exhibit towards one another makes such a massive difference to how we feel at work. And I think COVID really brought to the fore how much we need to look after ourselves as healthcare professionals and how we need to look after each other. I think maternity is definitely one of those places. We are looking after people at the most profound moment in their lives. When you have a baby, it really is one of the primary moment of human experience. And the weight of expectation on midwives to be there and be caring in the way that families need is there every single time a woman sits in front of them. And that's a responsibility we all take on, I think, very willingly, and we all want to do it, and we all want to get care right, and we want to make sure that things go perfectly for people. And so how do we make sure that the midwives who come with those high hopes and expectations to be really good practitioners, how do we keep them? One of the ways we did that was to fund a retention midwife in every unit to really offer that wraparound support and care. We've trained hundreds of professional midwifery advocates under the leadership of Claire Capito, our national lead for PMAs. And what you've delivered as PMAs, I know many of you on this meeting will be them, is training, reflection, supervision and support. And what that's done, you've really delivered a difference, because the turnover of midwives has decreased, the sickness rates for midwives have decreased, the vacancy rate has decreased, leavers are decreasing. So what we've seen is the work that you're doing makes a difference, not just to the people we care for, but we're caring for each other. And I think it's often one of the things that we reflect on is, well, why do you need a retention midwife? What difference do they make? What's that doing? Why is that happening? And I think for me, the magic ingredient is probably treating people as individuals who matter. They're important. They're not just a number on a rota. They're not just someone filling a gap and making sure that there's someone to turn up, but they are individuals. And it was one of the biggest things I learned working as a matron. I had about 125 people reporting to me, and all the time, the most important thing I did was the conversations that I had with individuals in my office, really hearing their perspective, understanding what was happening for them and trying to support them. And I just want to emphasise that is what I see when I go out. I see people talking compassionately about their colleagues, about the plans they put in place to make work possible for them. And that is so important, because the role of the midwife is changing. And I think many people are talking to me about this and saying, what does it mean? What does it mean to be a midwife now? Does it mean the same thing when we are seeing more operative births than we've ever seen before? We're seeing women coming to us with more complex health and social needs. We're seeing more women starting their labours through induction of labour, not going into labour spontaneously. Does that mean we're still midwives? I would say yes, it does, 100%, because midwives are there for every woman and every family. They give the care that is needed regardless of circumstances. And I think where we've seen is midwives have adapted and innovated. It just shows how incredible midwives are as a profession. We've set up triage departments, we've set up vaccination services, we've taken on newborn examinations, we've taught ourselves how we've been taught, not taught ourselves, but we've been taught ultrasound and learned how to do that. I met a fantastic group of advanced practitioners recently who are really looking at the boundaries of where they can be that bridge across services. Midwives have developed governance, instituted new training. We have an amazing digital midwives network. We've set up maternal assessment units. We've set up transitional care with our neonatal colleagues. All of this shows the innovation and care that midwives have, because what they're doing is responding to what it is that the people in front of us need. They are saying, "This, I see you, I recognise you, and here is the care that we can give to make sure we're working in partnership together at the most important time of people's lives." So I just want to thank each and every one of you for everything you do every day as a midwife. It is the most amazing job. It still fascinates me every day, challenges me, fascinates me. And I'm so proud to be working alongside such great people who bring so much to the profession. So thank you, and happy International Day of the Midwife.
We have a bit of a time, not long, but just a couple of minutes to bring all of our speakers together. And I know you have given your appreciations for midwives in London, across the UK and across the world, as you have talked. So I'm not going to reiterate that. But in terms of, I think it has been great to hear the way you set out your talks and the evidence behind it and what we are doing around why compassionate and inclusive care is essential to midwifery. But one thing that I hear, and I'm sure is familiar to everybody, and particularly Michael and Jill, because we often say the system is not set up for midwives in this particular instance to provide the care and the compassion they would really like. But we make the system. We are the system. So it'd be helpful to hear from your perspective. Is there anything else that we can do to support our midwives, so we celebrate this profession and the work that they do as part of your final comments as we conclude this session? Can I come to you first, Michael?
It's been a really inspiring session. Thank you. I think that the point that you made, Sian, and was also made by Omar and Jill, is really important, that we need to focus on the system and the extent to which the system is creating the conditions where midwives can deliver high quality care, because it's too easy to blame individuals when difficulties occur. When we know that there's a huge shortage of staff in particular locations, we know also that chronic work overload is a huge problem, and often the infrastructure, the buildings, the equipment are not available to support midwives to deliver high quality care. So we must address the system issues, and that's best done by collectively. I think the Royal College of Midwives plays a really key role in that, but the more we can bring the collective voices of midwives together to advocate for more effective systems, then the more positive change we will get, and it's absolutely urgent and essential. And second, I think it's really important that for all of the wonderful examples we've heard about midwives being so generous and kind, we need to encourage an awareness amongst midwives of the importance of being also self-compassionate and doing what they need to nurture themselves, to take care of their well-being, to turn that amazing love that they show to women and families and babies, to turn that on themselves and ask, what am I feeling? What do I need? How can I ensure my needs are met? Not as some narcissistic self-indulgence, but in order to nurture ourselves, in order that we can be present and compassionate and caring towards those we provide services for.
That's really helpful, thank you. And that self-compassion is critical, and it's something that often as midwives, particularly in the position of leadership, or no matter what your position is, we often forget, but thank you for emphasising that. Jill, is there anything you'd like to add as for your final comments?
I think my final comment is that, you know, every single individual in maternity services is absolutely trying their best against a system that quite often feels against them. So I think it is about that, valuing your personal contribution, like the stories we've heard today. Every day, midwives and the wider team come to work to try their best, sometimes in the face of adversity. And I think it's really important that everybody thinks at the end of that day that they did make a difference. Seek the right support for themselves and come together in that very powerful community to then continue to try to influence further up the line, to get the voices of women, people, midwives and services as high as we can, so that they really are valued absolutely as they should.
Thank you. Really important point to conclude. Omar, just to make sure that I have given you the opportunity, if there's anything else you want to add.
I think it's a lot about the culture of trust, celebrating those midwives. I do lots of 15 steps and walk arounds, and I'm always really disappointed where that board of the cards and the thank yous is not maintained, or it's just in a little corner. I think it's really about celebrating the hard work that they do and the acknowledgement that service users give them, because I think that's always going to be something that helps retain staff and reminds people. I think it's often the case that it's very easy to let midwives know when things go wrong, but celebrate when things go right. I think we need more emphasis on that.
That's a really important point, and I think a brilliant point to end on, that we need to acknowledge and recognise and celebrate excellence, and use that as a way to scale up good practice, because we have to admit there are times we don't always get it right because of the system that we operate in doesn't really allow that, but we should learn from areas where we do really well. So that's an important point. Thank you for that. So self-compassion and celebrate the excellence and the guardian angels, and using your RCM as a union in England, if you live in the UK, to help you, to give you that common collaborative voice are the key messages that you have heard. So as we come to the end of today's sessions, although we could have carried on because this is such a wonderful topic and we have some wonderful speakers, I'd really like to give my heartfelt thank you to all of our speakers for sharing their heartfelt insight, expertise, but really heartfelt experiences. So really thank you. And your contribution has really enriched today's discussions. I certainly enjoyed it. And I hope our viewers will enjoy it as much as I have and all of us have here. And I hope that we have left you with a deeper understanding and appreciation of the important role midwives play in shaping compassion and high quality care. And finally, to our midwives, this is, after all, International Day of the Midwife. So our London midwives, our midwives working across the UK and midwives working globally. What you do matters. Every interaction shapes the birth experience, as you have heard through some of the stories. It really does empower a family and leaves a lasting impact on the next generation. So to all of you, wherever you are, thank you for your passion, compassion, and your care. Thank you for all that you do every day for every family in every moment. And goodbye.